on the ground within those jurisdictions. Of course, in my studio, I do have, yes, two very intelligent individuals. That is Honorable Asamo Helen Gray. She is the Minister of State for Disability Affairs. I'm also joined by my comrade. It's been a long time since I last saw him. That is Robert Nkwangu, the Executive Director for the Uganda National Association of the Deaf. Robert and Honorable Asamo, thank you for joining us on Morning at NTV.
Yeah, thank you so much.
Deaf Awareness Week. What kind of activities has government put aside to actually mark this auspicious week and shine a light on the plight of people living with disabilities, especially those with hearing impairments?
Okay, thank you so much, Romeo, for this. First of all, I want to say that we thank God for bringing us through to this day of the Deaf Awareness Week.
Indeed.
And we want to believe that we want to create advocacy issues. First of all, as government, the issues of laws, right from the Constitution. One of the important things government has put in is to recognize sign language as a language that helps the people with hearing impairment to communicate. And I want to appreciate that we have tried to get into TVs to ensure that we insert an interpreter, like the viewers can be seeing one of our colleagues already interpreting. Unfortunately, we only look at the news, but not looking at other activities. But I think we have started a process, and sooner or later, we shall be able to increase. We have been able to look at education, and in the government of Uganda, we have been able to provide schools, like we have the Wakiso School for the Deaf, specific for children with learning impairments. We have also seen the Intinda School for the Deaf for the primary. We have Mbale School for the Deaf, where they do both vocational as well as learning. So government has put in so that they can be educated, they can be trained through vocational institutions and be able to be supported. We have also been able to ensure that as government, we recognize the deaf people. And you know, in Parliament, we have one of them as our members of Parliament, Honorable Undesi. And I think, for me, government is ready to work with the deaf community to ensure that we have full inclusivity in all the atmospheres and areas that government works. Yeah.
Robert Nkwangu is the Executive Director for the Uganda National Association of the Deaf. Please engage us and acquaint us with what kind of activities you've earmarked to actually expedite during this week of this Deaf Awareness Week.
Yes, thank you very much, Romeo. Thank you, NTV, first of all, for the you've been airing our programs very, very well, because I remember a week ago we had a special program of My Silent World, where you really sensitize the community about the challenges that persons like me face. I mean, the experience in the world, in the community out there. So thank you very much, NTV. So this week, it begins with the UN, with the World Federation of the Deaf, and then this week largely focuses on creating awareness on issues that are affecting persons with deafness, because we need to be engaged and involved in different activities. We are celebrating the thriving communities of deaf community, and that means we sign for human rights. So these activities are this week. They started yesterday on Monday, and well, like we have a talk show today. We are going to have radio talk shows around the country, and we're going to have workshops that we are going to use to sensitize the community. Previously, we have been at the Ministry of Gender, and we had a workshop about the special grant, and also had a petition to the public service about what needs to be done for deaf persons, especially in the employment world. Indeed. And of course, the language interpreters as well, because we live in the same community. So moving forward, the very many activities talk about the healthy camps. My minister has talked about the football competition, but unfortunately, because of COVID, we may not have it. So a number of activities, and of course partners have been with us, not forgetting UNFPA that has been supporting us for all these activities. Yes. UNFPA has really supported us in this year's activities, and that's quite very important because we're talking of health, because just like our minister said, COVID has brought about challenges, especially with the children. I mean, deaf persons being taken advantage of, some have been raped, others defiled. I mean, access to services has been quite a challenge, especially those related to health. So this week we are doing the same thing. Yes, thank you very much.
All right, that is Robert Nkwangu, Executive Director, Uganda National Association of the Deaf. We also do have Edison Muhwezi, Dr. Edison Muhwezi. He is the Assistant Country Representative of the United Nations Population Fund. A very good morning, sir. Thank you for joining us on Morning at NTV. What kind of activities has the United Nations Population Fund earmarked for this Deaf Awareness Week? Mr. Edison.
Thank you very much for hosting us. I'm really good morning, viewers. This is an opportunity really for us as United Nations Population Fund and the whole UN to make sure that we raise the profile of the deaf people and in general the people living with disabilities in the country and even globally. So we have a lot of activities. We have community activities going on. We have different meetings and workshops which are really sensitizing different stakeholders like politicians and community leaders, traditional leaders, cultural leaders, basically to raise the profile of people living with disabilities. And this, of course, is going to be crowned in Arua with the national commemoration, which we are part of. And the good thing, we have staff at the United Nations Population Fund who are people living with disabilities, and one is actually a person with hearing disability. So we have a good team which is really supporting both the government and other civil society organizations to make sure that we raise the profile of disabilities, and particularly people with hearing disabilities. So there are a number of, including this talk show, of course, where we are participating. But the bottom line is that we are really making sure that we raise the profile of people living with disabilities. And for this whole week, and even for the past 2 weeks, we have been conducting several activities, and this will be crowned in Arua as we have the last day of commemoration. Thank you.
Dr. Muhwezi Edison, issues to do with gender-based violence, sexual abuse have taken root, especially in communities and among people who are non-disabled. We also do know that it's more compounded among people with disabilities, especially those with hearing impairments. So how rife is the spread of this problem on the global stage?
Yes, on the global stage, we are making sure that there is no discrimination, because human rights is really inherent, irrespective of sex, age, or tribe, and even disability. So what we are doing on a global arena is to make sure that there is disability inclusion in whatever we are doing. So it is integrated in all our programming. And Uganda is also a signatory for UN Convention of the Rights of Persons with Disabilities. So we work with governments to make sure that this is actualized. And also we are making sure that people with disabilities, particularly with hearing disabilities, have equal access to services, information and services, including sexual and reproductive health services, without any discrimination. And they have the right to have the children they need, they have the right to marry, and they have to be given dignity and respect without any discrimination. So, and there should be equal access without any, and we are making sure that also build the capacity, especially of the healthcare workers, to make sure that they can be able to communicate and also provide some information and services to people with disabilities, particularly those with hearing disabilities. So we are doing a lot at a global stage, but the bottom line is to make sure that there is ensuring equality and inclusiveness, making sure that people with disabilities have equal access to information and services, and they are treated with dignity.
That is Dr. Muhwezi Edison. He is the country representative courtesy of the United Nations Population Fund. I also do have the Minister of State for Disability Affairs, Honorable Asamo Grace Helen. She's also here with us. A very good morning once again. We've noticed an uptick in the prevalence of GBV cases, sexual abuse cases or incidences, if you will, among the disabled people, especially those with hearing impairments. What are some of the push factors behind this prevalence of GBV or sexual abuses that we have been seeing during this COVID-19 pandemic? And what are you doing to curtail the same?
Okay, thank you so much, Remy, for the question. I think all of us in Uganda know that COVID-19 has come with a lot of challenges.
Indeed.
And when COVID-19 entered in, the poverty levels also dropped. And some of our people who could have been...
The poverty levels went up.
Yeah, they went up. And I mean, went up. And then you realize that most of our people were doing this kind of petty jobs.
Yes.
And they didn't have where to take some of their commodities. So eventually, some people take advantage of them. I will tell you, if you get a girl with a hearing impairment, she doesn't know what to do. And because of the nature of being a deaf girl, they usually have a smiling face. Somebody gets attracted to this person, they mess with them, they get them pregnant. Either they give them STS or they give them other diseases, HIV, AIDS. So this young girl is suffering from a disease, goes to hospital, the medical people don't know what to do with them because of the communication gap. I really want to bring the issue of communication as one of the big challenges in negotiating issues of GBV and issues of supporting these people. One other thing that you realize as we look at COVID-19, some of them became sick. They were affected by COVID-19, but they could not explain their status because when the messages were going out, they did not have the language of the deaf to communicate to the deaf community. So most of the programs that Minister of Health was passing out, the government was passing out, I think there we didn't do very well to look at the community of people with hearing impairment. So when they got affected, they did not understand where next do we go. And you remember that time of isolation. You are isolated, but a deaf person is an interpreter to explain the issue. So these persons died quietly and silently. I think those were the challenges. But I think
even the reporting challenge also, Honorable Asamo Grace, they couldn't report the perpetrators simply because they had hearing impairments, speech problems for some of them. They couldn't report to the police or write a statement putting an account of what actually happened to them. And the perpetrators were taking advantage of that because they couldn't report them.
No, they could report, but the person you are reporting to does not understand your language. So you are in a problem because the most important thing
you can't write a statement
in this celebration is for us to recognize sign language as a language that is very important to people who with hearing impairment. Because if I come on the counter and I report and I say, this has happened to me, the policeman
there is no sign language interpreter.
He says, what is happening to this one? So you justice delayed, denied is justice what?
Indeed.
Delayed. So at the end of the day, we realized that our people were really put in a situation where they did not get justice. And this celebration is talking about human rights. And this human rights is what we want to promote. And promoting human rights for hearing impairment needs you to have sign language. There can be a community of hearing people, but without sign language, even remember in this studio, if we didn't have a weak clip here, we would get stuck with our message. So I think for me, I want to think that government should take the issue of sign language as a very critical area of helping people with hearing impairment to gain their rights. Because if I'm sexually harassed, I have to speak, but I cannot speak because I am deaf. So I need to get to police and find a sign language interpreter at the counter who can be able to give my message. I have a problem. I've gone to hospital. I must get somebody there who is able to support us. And that's why I think they took the petition yesterday to public service. I hope public service will listen to the hearing community and begin recruiting sign language interpreters. We have now a big number. I think we have over 500 sign language interpreters qualified at diploma level, trained by a government institution, Chambogo University, and that's what I give a credit to government of Uganda, that we have given the training, but we have not given the placement.
Indeed.
So that's where the challenge is.
Honorable, persons with disabilities, especially those with hearing impairments, also grapple with so many other things to do with accessibility to health services, reproductive health services. You do have health workers who live in Uganda. Oh, you are disabled, and you also need contraception in that regard. So they've been discriminated by the health sector itself. What is government doing to actually alleviate this problem? Are you retooling the health workers?
Yeah, I think in our act, the Disability Act of 2020, we have said sign language becomes part of the curriculum of the Ministry of Health, the Ministry of Education, where social services are given, so that it becomes an issue that anybody training in that institution takes at least a course on how to manage issues of sign language. And that has been put in the Act, and I'm happy that the President already assented to it, but now we're waiting for the implementation to ensure that we get these people on board. Because until you have sign language interpreters present, then you cannot help the people with hearing impairment. Even as a minister, if a deaf person walks to my office, I'll get stuck.
Indeed.
Then I begin using papers, right? Supposedly the person doesn't know how to write. So we shall be exchanging and exchange. You don't have good conclusions. So I think we need to promote the issue of sign language to achieve the human rights of
another challenge, Honorable Samuel Helen Grace, that has taken center stage during this COVID-19 pandemic is the absence of safe spaces, safe places, if you will, for survivors of gender-based violence.
Yeah, that's true.
Only FIDA Uganda is actually doing more to create these safe places or safe spaces for people with disabilities. What is government doing to actually create more safe places for our people?
You know, government of Uganda works with partners. So even if you say there's FIDA, we also had, I think UONET had some places where those had put them. The only challenge we had, because of COVID-19, the services, for example, provision of food, provision of health things in those centers, spaces had a problem. So I think for me, I want to say that as government, we're already thinking of how to build shelters to handle issues of GBV, especially for people with disabilities, but also generally, all other people who are affected by GBV.
Indeed.
Because at the end of the day, GBV is not specific for disabled people, but it's an issue of the national concern to the country.
All right.
Yeah.
Let's also bring in Robert Nkwangu, the Executive Director, Uganda National Association of the Deaf. Robert, would like to know what your association is doing or has been doing during this COVID-19 pandemic to render services to the people dealing with this, many of these disabilities, especially hearing impairments.
Yes, thank you, Romeo.
Yes, Robert.
The statistics that we have in the country, we have around 1.8 million deaf persons in the country.
That's a big number.
And of course, that's a big number. And personally, it's hard to tell whether I have a disability or not.
Yeah.
Simply looking at me.
You can't
because
tell.
very many people come and talk to me until
Robert.
when I begin saying, that's when they know I have a disability.
Yes, Robert.
So in the community, you'll appreciate that there are very many deaf girls that are in the community that are pregnant, and many that have had babies, but they don't know who their fathers are. They don't know who their fathers are. They don't know who made them pregnant. I mean, so sexual abuse has been happening, especially in this pandemic. But most of the times, the deaf persons usually go to the institution as UNAD, but then we are being closed as an institution. So then the situation becomes very hard for them. So COVID has brought in more challenges, I should say. Take an example, Romeo. The health care services, the nurses, the doctors, I mean, a few of them know sign language, just like our minister said. Most of them have been coming to the hospitals. At times some have been positive with COVID, but they cannot ably express themselves. They cannot communicate in sign language. So it presents a very big challenge. Ourselves, you know that UNAD is an NGO and we depend on donors for support. So we cannot do everything. We cannot, put out the information about COVID-19 in sign language unless it is government that has come in to help us. Indeed. So secondly, looking at the schools that have been closed, our students are learning online. Those who can, of course. And then radios and TVs, there are no interpreters there. I mean, if at all could have an interpreter on radio, I mean, how can someone learn on a radio who is deaf? You understand? Look at our TV stations that we are having teachers teaching chemistry, biology, and all that, but no interpreters. So it is an advocacy that is ongoing, that we are pushing to see that the sign language interpreters that are being put. My honorable minister has aired this out, that government needs to do a lot through her ministry. We are lucky that previously they appointed a staff who is a sign language interpreter, but then she only caters for all the entire ministry. So we need more of the same, but at least she has given us an idea of how these interpreters work. So this information that has been running on TV or about COVID, they don't send better, they do this and that, washing hands, using sanitizers. I mean, it's not put in a language that people like me do understand. So sign language needs to be at the center of all these. They should have interpreters in the health sector, in the education sector. We should have everything in sign language such that we uplift the rights of persons with hearing impairment. The issue of sexual abuse, Romeo.
Yes.
Personally, I need to tell you that we have very many HIV positive young men and women who are deaf, and they've started these relationships, of course, unknowingly, 1 or 2 years ago.
Forced relationships.
Of course, yes. And then previously, with when you sit exams of UNEB, most of them really failed.
Wow.
Right?
At UNED.
The parents don't know sign language. Now the failed exams, I mean, that will be the end of the parents. You go and marry an old, and you go marry off and go do work. I mean, this is what is happening out there. So it is an outcry. I really feel that it's quite important to mainstream all these programs in a language that we all understand, because when we miss out, we fail the aspect of affirmative action. Madam Minister, I'm so sorry to let you know that COVID, the relief food, that, of course, what we call the Centezana Banja.
100K.
The Centezana Banja, we, the persons have not benefited from Centezana Banja.
Yes, Robert.
You know, we don't know how to get this money. We don't know where to register. We don't know. I mean, we don't know a lot of things because it wasn't available to us in the first place. Now, most of our deaf persons have been running to UNAD asking us, Centezana Banja Ziriwa, have been asking Honorable Alex Indezi, where is this money? We need food, we need posho, we need beans. I mean, and a few cases have been going to our Honorable Minister because they know her place, asking her, Mommy, where is our food, where is everything? So it has become a personal initiative of me, Robert, Mommy, Helen, and everyone to give out this food. I mean, we need affirmative action, Romeo, to see that all these programs are really cutting across all persons. Indeed, to make sure that our rights are protected, because the way you communicate with other people is the same communication that we need as persons with hearing impairment, and then that cooperation will help us move forward. I want to thank Mama Honorable Minister, is that your colleague your colleagues in the education ministries, finances, and all that, they need to do a lot. They need to copy a leaf from me, at least from Ministry of Gender, and copy and replicate what you're doing there. I mean, the government, our president, we have the laws in the land. The Persons with Disabilities Acts, the affirmative action is staying in place, the convention, rights of persons with the disabilities, and our president has done his best. But then the departments, the agencies, I mean, there's an issue with the implementation. So that's why we really recommend that people with the disabilities, I mean, in our act, we need to see these guidelines put out there urgently, as fast as possible, such that they help us implement. NTV, you're lucky. You have sign language interpreters here over and over again, but these are on this shows that something has been done. But this is a private entity. NTV is a private entity. But then the public sector, I mean, why is all this missing out in the public sector? Yet they're supposed to be the lead in all this. The private is taking on the lead, but then the public is having an issue.
The government needs to step up.
Indeed.
Also, Robert, there is also a challenge when it comes to accessibility of education. Even when our education institutions were open, it was hard for our persons with hearing impairments to access conventional schools. Robert, you have to part with 60,000 Uganda shillings as a learner on a daily basis to have an interpreter within the class. What can government do in that regard, Robert?
Well, from my experience in the university, I should say, I personally paid my interpreter.
60,000 on a daily
I paid my interpreter. After paying my university tuition, had to labor again and pay my sign language interpreter. Government has tried to support with the interpreters in the university, Chamgo University per se, and the sign language interpreters, especially to the students in the universities only.
Yes, Robert.
But that is only for government-sponsored students only. The private-sponsored ones, they cater for themselves, especially in the other universities. They don't have, say, this support of the interpreters. That's what the practice is.
All right.
That's why most of them are suffering, and majority are dropping out of the university because of that. So the Ministry of Education, it's sadly, I can tell you sadly that there's no interpreter in the structures.
I see.
So the Ministry of Education, where is it? We don't have any interpreters in the structures. The Office of the Ministry of Education, there are no interpreters. Take an example. The General Ministry has one. But then other ministries will literally have nothing at all. So this is something that we are pushing for. As the person need to go to school, they need interpreters to help them understand and learn in class. But also, Romeo, aside the interpreters, the teaching materials is quite alarming. The materials we have are not accessible in sign language. I think we are pushing for the digital materials to help our learners with hearing impairment to learn because they're in sign language. Thank you.
Robert Nkwangu, Executive Director for the Uganda National Association of the Deaf. You also have the Assistant Country Representative, courtesy of the United Nations Population Fund, that is none other than Dr. Muhwezi. Edison is still with us online. A very good morning once again, sir. Well, Robert has been divulging some of the challenges or gaps that are befallen persons with disabilities, especially those with hearing impairments. What could be done, especially with you, our international partners, to alleviate some of these challenges and the suffering of the persons with disabilities, especially those with hearing impairments? Edson? Muhwezi, Edson, can you hear me?
Thank you so much, Mr. Romeo. That's a very important question, and we, as the United Nations, we have the Sustainable Development Goals. And one of the key principles of the Sustainable Development Goals is leaving no one behind, LNOB, leaving no one behind. And therefore, the people with disabilities have been prioritized globally, led by the United Nations. So that's very important that we influence government, CSOs, and all stakeholders to make sure that we have an affirmative action for people with disabilities. And we urge all countries to respect the UN Convention of the Rights of Persons with Disabilities.
Indeed.
And the good thing, like Uganda, is a signatory to that. And they are all principles, they are all values, they are all criteria, they are all activities to be done to make sure that this convention is actualized. So we are working with governments to make sure that we actualize this convention because it spells out all the details. And other than that, other than the advocacy and raising the profile, we also support financially and logistically. So like for this week, United Nations Population Fund has provided financial support, logistic support, and even technical support to make sure that things are actualized. So in a nutshell, we work with governments to make sure that the United Nations Convention of the Rights of Persons with Disabilities is implemented, since most of the countries are signatories. Or we make sure that they have the resources, they are facilitated to make sure that people with disabilities are really given an affirmative action.
Dr. Muhwezi,
the bottom line is that we leave no one behind.
Leave no one behind. That is a great, 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 great submission. Dr. Muhwezi, prioritizing the disabled people during this COVID-19 pandemic is actually one of the avenues through which you could alleviate their suffering. They're just, focusing on their plight, prioritizing their challenges. Honorable Asamo, what is government doing to ensure that we achieve this target of prioritizing the disabled people, especially those with hearing impairments?
Yeah, first of all, I want to say that, as Dr. Muhwezi has said, the issues of SDGs, the issues of human rights are top on the agenda of government. And I think we know that the theme of government, right from the NDP3, is about inclusivity.
Indeed.
And we want to believe that including everybody, whatever status, is one of our priority areas as government begins to run the programs of the NDP3.
Indeed.
One thing I want to say about disability, I don't want to say people don't want to include the disabled. Sometimes they don't know what to do. For example, if this station was not told that they need a sign language interpreter, we are not guided how to bring the sign language interpreter.
He also mentioned we need sign language interpreters within our schools.
Yes,
what is your office doing about that? And many of the disabled people, deaf people, if you will, did not receive any of the Nabanja money, the 100K. What is your office doing about it to fast track?
I am not sure that I will know who did not receive the Nabanja money. The Nabanja money was out in the public. And if there was a deaf person who was in those categories, I'm very sure that they must have received some of this money.
All right.
I know of somebody who is this was who called the taxis. He was able to get some money from, I think he stays in the city. He was able to get the money. But all that we have not known from the categories who got the money, Nabanja money, who was disabled, who was a woman, who was a young person, that kind of thing. But I want to say that as government of Uganda, and I want to assure the community out there, we are working on the regulations which are going to operationalize the Act. The Act has got all the ministries, departments, and agencies.
All right.
And I want to think that as government, we are working with everybody, and I want to assure my friends from the hearing community that we need to continue with advocacy. We need to tell people what is our message and then try to bring them to our side to see how to include.
Honorable Asamo Grace Helen, Minister of State for Disability Affairs, thank you very much for your time. Robert Nkwangu, Executive Director, Uganda National Association of the Deaf, thank you very much. Bukenya on sign language, thank you very much. And also you, Dr. Muhwezi Edison, thank you very much for having made the time to actually engage us. Let's go to Ntinda and talk to Stephen Imbide. He has a conversation for us. A very good morning once again, sir. What's the latest?